Hello, and welcome to our 2021 Education Day. I'm Ann Spencer, and I'm a licensed genetic counselor, and I'm going to be talking to you today about the decision, in the context of the decision to pursue pre-symptomatic testing for Huntington's disease. So that's testing for people who are not showing symptoms but have a 50% risk of having inherited the gene from one of their parents, and doing that testing process to be able to discover if you inherited the gene that causes HD, or you inherited the form of the gene where you would not develop HD. So that's what I want to be talking to you about. But first, I just want to show off my collection of vintage Team Hope walk shirts, and I'm also wearing this one, and I thought that they made a colorful way to present our Education Day. We have to liven it up a little bit since we can't be in person. I wanted to add some color to my presentation. Um, and we are looking forward to a Team Hope walk later this year. So keep your eyes open for that, and hopefully you'll be able to join us in person for that. As always these days, fingers crossed, hoping that it'll happen. But definitely a hope to see many of you in person later this year. So on to the topic of pre-symptomatic testing for Huntington's disease. This is something that I've been involved with for at least 20 years, and in that process I've worked with well over 100 families that are in the process of making a decision to get tested, or are have made the decision to be tested. And I've learned a lot from them, and so I really want to share my experiences with what I've learned, so that it can help you think about how to make the decision, or when talking about loved ones, talking to loved ones who are thinking about the decision, to give you some resources and strategies for how to think about it. Um, I think the main thing to remember and to think about is with the the decision to get tested to see if one has inherited the Huntington's gene from an affected parent, is that it's a deeply personal decision, and that from a medical standpoint, it's not a medical decision; it's a personal decision. Uh, that there isn't a right choice. It's not right to get tested, and it's not wrong to get tested. That decision is made in the context of your own life, and your relationship to those around you. So there's nothing that you're supposed to do. Sometimes people will talk to me and they'll say, I guess I should get tested. And there really isn't. If you're not showing symptoms and you're just living at risk without symptoms, there's really not a strong reason to get tested, and there might be some strong reasons to not get tested. So um, it's not something that you should ever feel that you have to do. You should only do it if you genuinely want to do it and have really thought about the implications. And so um, I'll step right into the next step on that. The reason that it isn't necessarily the right thing to do to get tested is because there's no actual medical benefit to getting tested for Huntington's disease um, before a person has symptoms. It doesn't change your treatment. It doesn't change your day-to-day medical management. There's nothing that your doctor would be doing differently. We do, of course, recommend for everybody that they live a healthy lifestyle and eat well, and we believe that those things are helpful and protective to some degree. But honestly, we should all be doing that regardless of our genetic status. So there isn't, from a medical standpoint, anything we're going to do differently if you get tested and find out that you have the Huntington's gene. And because of that, then we can't say that you should get tested from a medical standpoint. It is a personal decision. Um, in the future, we sure hope that there will be treatments and a cure for Huntington's, and maybe as time goes on, we will actually learn things that we would ask you to do differently if you tested positive for the HD gene. And in that case, when that time comes, then it would be probably a very good idea to get tested. If you knew that if you tested positive, you could actually do something proactively and differently to either prevent or treat or manage the disease before symptoms even start. That would be awesome, and we're looking forward to that. And at that point, it's going to change, and we're going to probably say, yeah, it's a good idea to get tested because we can do something about it. Till that time comes, it really is, it's a personal decision that you make based on what you think is going to be best for you. Um, There are some downsides to getting tested, and particularly what I see is that when people get tested, it can affect their ability to get certain kinds of insurance, particularly life insurance and long-term care insurance, which are often things that you want to have in place if you are at risk for Huntington's. And so once you have those, if you have a positive gene test, it's much harder to get affordable long-term care and life insurance. And so you want to make sure that those kinds of things and other life planning things are in place before a person proceeds with testing. It can also affect your relationships with the people in your family, and sometimes people who test positive feel a different relationship to other members of their family. Sometimes people who test negative feel a different relationship to their family based on their result. And so partly what you want to be able to do is to plan ahead and think about how those test results might affect you, and be prepared for those things ahead of time instead of scrambling to try to pull things together after you've already gotten a result. One of the things that I really like to just tell everybody is that you can only change your mind one way. And what I mean by that is that if you decide not to get tested now, you can always change your mind and get tested later. However, once you've been tested, you can never get untested. Once you know your result, you can never unknow the result that you have. And so taking some time at the beginning of the process to really think about and really consider the pros and cons of getting tested and the possible things that might happen um, with your results, and how you might use them and who you might tell about them. Thinking about that ahead of time means that if you do decide to get tested, that you will actually be in a um, you'll be you'll be prepared for those results, and you won't be hit with surprises that you weren't expecting. And so I really encourage people to take time and really think thoughtfully about going through with the testing. Um, let's see, what else did I want to tell you guys? I think, one of the things to think about is that the testing process can be emotional, um, and and negative results can actually be emotional as well. Often, people who find that they have a negative result actually feel guilty and feel, especially if a family member, especially a family member that they were close to, has tested positive or has the disease, there can be this sense of what we call survivor guilt. This feeling that, yeah, why did this happen to my family member, but it didn't happen to me? And there can be this extra sense of guilt and even responsibility that because a person was spared that gene, and they were from a Huntington's family, that maybe they should be doing more to help and support the family, and that guilt can really be a burden, and it can actually cause more problems within the family. So I always like to just alert people to that possibility, that even though finding that you don't have the gene can be really a release and can really feel good, in other ways sometimes it can also create this other more negative feeling, and just being aware of that ahead of time I think is helpful. For people who do decide to go ahead with the testing or are getting close to making that decision, I would ask them to consider some really practical questions, which is around information management. So what I mean by that is, who knows that you're getting tested? Who in your family have you told? Who may be in your family or your larger support network do you necessarily not want to tell? And I mention that because sometimes when results come back, uh, and people have told a lot of people this is the day I'm getting the results, they may be really emotionally overwhelmed, but find that they're having to take care of all their family members and they're getting a ton of phone calls. And so just being proactive and thinking carefully about who do you tell, that you're starting that process. Who do you tell when you're getting tested? Is it just a small group of very close friends, or maybe just one person? Um, I think that's really helpful to think about. When I do the testing, when I'm involved with that, what I have people do is come through the process with a support person of some kind. So at least one person that they've talked to who knows everything that they can lean on, turn to, even if they have to call somebody in the middle of the night because they just um, are feeling like they need to connect with somebody because of whatever feelings they're having. So I think it's helpful to have at least one person to support, but you might not want to have 5 or 10 or 20 people. Um, that you are then potentially having to contact and give those results to on the day that you get the results. So just managing who has control and who you want to share that with. Um, let's see. I think the other questions to think about with the testing are to ask yourself, what's the benefit, right? Why am I doing this? Why does it matter? Um, why? Yeah, why? What good is going to come out of it? What's going to be better for me? What's going to be better for my family if we have this test result? And to think really concretely about that. And you may find that really not much is going to change if you get tested. And in that case, again, I don't think that it's really that beneficial to do it if you don't see some reason to do it. And then the other question is why now? Why would you want to get tested now? And why is it better to do it now than 6 months from now or a year from now or 5 years from now? And again, keeping in mind, right, you can only change your mind one way. So if you get tested, you can't go back and get untested. If that information is in your medical record, in your medical chart, it's in your medical record, in your medical chart, and it's probably not going to go away, and it's going to be something that people see and have access to. And so, are you ready for that possibility that that it's going to be positive, and you and other people are going to know that result. And if you decide not to get tested, then again, when the time comes, you can always go ahead and get tested. But once you've been tested, you can't get untested. So those are the sort of the bigger issues that I wanted to share with you in terms of thinking about getting tested. Again, I think I see a lot of people who think that they should get tested, and this isn't a should thing. This is really when you're ready, if you're ready thing. And you want to do a lot of things ahead of time to prepare for that test. You don't want to just show up and do it at the spur of the moment because once it's done, it's done. You can't go back and undo what you've done. So there are some resources that I am going to have that I'm going to share with you along with this video. So whatever format you're at, you should be able to link through to them. And one of them is the HDSA website has a list of resources for people. So if you go to the www.hdsa.org, and then you can click on the link that says locate resources, and then that will take you to a page which has a whole bunch of different resources for HD, and you want to choose the one that says genetic test centers. I think I have to look at this. Yeah, genetic testing centers, and click on that, and then once you're there, you can choose the location that you're in. you can select that, and then that will give you a list of centers within 50 miles or 100 miles of that location. So you can see those are all centers that follow a protocol for testing, which is similar to the one that I do. And that's going to be your best bet. They're the ones who are going to do the best job of getting the testing done. And most labs will not accept a genetic test that has not come through one of those organizations or somebody who is qualified to do the pre-test counseling. So that's the best way to find the resource if you decide you want to go ahead with testing, or if you want to meet with somebody like me who can talk you through that process. And then the other resource is a book that is on genetic testing for Huntington's disease, and it covers a lot of the things that I've talked about, as well as some other practical issues in terms of getting tested, and a little bit more information about the genetics of the disease and how it's inherited. So I will include that link for that, where you can download a PDF of that booklet as well. And hopefully that will give you some information. I hope this was helpful. I hope that this gave you a bigger context in terms of thinking about the testing. And happy HD Awareness Month. Take care, everybody.